Hi, my name is Jillian Soder and I am the owner of Body Labs Yoga and Education, and I am on a mission to create more confident yoga and movement teachers through anatomical insights. So today we're going to talk about the low back and complaints of discomfort in the low back, which is super common, okay? So let's take a look at Stan here really quick. And the low back is an interesting structure or area of the body, I should say, because it has so many different moving parts to it, okay? So what we have happening in the low back here is we've got these two large, what's called innominate bones on either side. When you put your hands on your hips, that's what you are placing your hands on, is right on the top of these large bones here. And then in between those two, we have this structure right here, which is the sacrum, okay? And that sacrum is right in the midline of your low back down towards your glutes. But then we also have these lumbar vertebrae, okay? And that's the area that we're going to talk about today, is how the lumbar vertebrae interact with the rest of these structures. So you can see that the lumbar vertebrae, and we know that they're lumbar vertebrae because they don't have any ribs attached to them. So that's the difference between the different levels of ribs in the body. We've got the cervical ribs up at the top here, which are in the neck. We've got the thoracic vertebrae, which are in the torso here, and those thoracic vertebrae have ribs attached to them. And then we've got the lumbar vertebrae, which are a lot more robust in order to support the weight of the body that is up above. And these lumbar vertebrae have a limited amount of movement to them. There's not a lot of flexion and extension available to them. There's not a lot of rotation available to them. And so they really are there for stability, okay? But what tends to happen is that when people go through their lives, they start to kind of do this anterior pelvic dump, okay? So if you were to imagine your pelvis being a bowl of water, it would be pouring water out the front side of that. And sometimes the belief is that the issue is in the posterior side of the body, which is not entirely incorrect, but what is typically the initial instigator to that sort of habitual movement in the body is actually on the front side of the body, all right? So when you think about your movement patterns in your own body, do they tend to be a little bit more of like this hip flexion throughout your day, right? Think about it. You're in your car seated, you're on the couch seated, you're at your desk seated. How do you lay in your bed even? Are you in that curled position in your bed even? So do you spend a lot of time with your legs and your pelvis in this sort of orientation? I would argue most of us, that's the case. So here's what is happening when those are our habitual patterns. We have a muscle that is going to attach onto the lumbar spine, and it actually has multiple attachments all the way down the length of this lumbar spine on either side of the spine. And it's going to attach up here on that lumbar spine, and then it's going to come down through the pelvis, cross over the front of the pelvis here, and then it's going to come down and it's going to attach. Do you see this kind of bump right here, this little nubbin? That is the attachment point for that muscle. It is the only muscle that goes from the torso directly down onto the lower limb. And this is called the psoas muscle, sometimes referred to as the iliopsoas, okay? So it just depends on your lineage of anatomy, but we'll just, for simplicity, I'm just going to call it the psoas. And what can happen when we are habitually in this flexed position through the hips is that the psoas will become, it will have a shortened tendency, okay? And so it will be engaged, but that does not necessarily mean that it's strong, okay? An engaged muscle, chronically engaged muscle, is actually engaging because it feels weak, okay? And so allowing that muscle to create a little bit more stability, strength, and length all at the same time is really supportive to the low back, because what starts to happen when that psoas is shortened is that we have this dump through the pelvis. It pulls the lumbar spine forward, causing that pelvis to shift in its orientation, and then we get a lot of pain and discomfort in the low back. So we're going to talk about that in our movement portion. I hope that helps.